Good afternoon, folks. I have discussion B for you. We're discussing what are the options for long-term care coverage. Okay, this is for everybody's FYI. Okay, I'm gonna do this one for you. Okay, what are the options for covering long-term care? The challenge: longevity is rising, which means people with uh, more people will need long-term care. Seniors increasing Seniors increasingly fear outliving their savings and being unable to afford help with daily activities like bathing, dressing, eating. According to Glenworth's 2023 survey, the average annual cost for private nursing home room is $116,800 per month, a daunting figure for many. Planning ahead. Give me 1 second. Early planning gives individuals more control and options for managing future care costs. Coverage options. Long-term care insurance is key strategy. It typically covers care for chronic illnesses, dementia, or severe cognitive decline. Benefits kick in when someone can't perform at least 2 out of the 6 activities of daily living, such as bathing, dressing, or eating. If you'd like, I can help compare long-term care insurance with other financing option or models like hybrid life policies, Medicaid strategies, or community-based alternatives. Okay, guys, I'm going to get into those for you with this presentation. So please sit back and enjoy. Want to co-design a culturally responsive care plan toolkit next. Long-term care insurance isn't the only path, especially for those navigating affordability, eligibility, or a cultural fit. Here's a breakdown of viable alternatives with pros and cons to help you think systematically and adaptively. Okay, I'm going to go through these now. Alternatives to long-term care insurance, options, descriptions, pros and cons. Self-funding with savings. Set aside personal assets to cover future care costs. Full control, no underwriting, risk of depending savings, uh, unpredictable costs. Hybrid life insurance policies combines life insurance with long-term care benefits. Dual purpose. Many offer tax advantages, higher premiums, less flexible than standalone LTC. Annuities with LTC riders. Income generating annuities that include long-term care coverage, guaranteed income, LTC supports. Complex terms may require large upfront investments. Health savings accounts, tax advantage savings for qualified medical expenses, triple tax benefits, a flexible use, only available with high deductibles for health plans, limited contribution caps. Let's see. Medicaid planning, strategic asset management to qualify for Medicaid, covers most LTCs, costs if eligible, requires spending down assets, limited provider options. Veterans benefits, aid and audience. Programs for eligible veterans can cover in-home facility care, in-home or facility care, strict eligibility, long application process, community-based programs, PACE adult daycare, and local nonprofit services. Culturally responsive, often low cost, limited availability, may not cover full care needs. Myth busting guide on LTC insurance versus alternatives. A community resource map integrating rural and cultural specific supports. Would you like to explore how these options align with infrastructure gaps or caregiver support strategies you're working on? Long-term care insurance isn't the only path, especially for those navigating affordability, eligibility, or cultural fit. Here's a breakdown of viable alternatives with pros and cons to help you think systematically and adaptively. Alternatives to long-term care insurance. Options, descriptions, pros and cons. Some of these are duplicates, so I've got to go through them and see which one's already read. Okay, only available with high deductible health plans, limited contribution gaps or caps. Medicaid planning strategic asset management to qualify for Medicaid covers most LTC costs if eligible, requires spending down. Okay, these already read. Want to co-design a decision-making framework for marginalized community? We could build a care funding decision tree tailored to cognitive health trajectories, a myth-busting guide on LTC insurance versus alternatives, a community resource map integrating rural and culturally specific supports. Would you like to explore how these options align with infrastructure gaps, caregiver support strategies you're working on? These are quite a few persistent myths about long-term care that can derail planning and policy reform, especially in marginalized or aging communities. Let's bust some of the most common ones. Common misconceptions about long-term care. Myth, reality, implications. Long-term care is only for elderly. 40% of people receiving LTC are under age 65. Planning should include younger adults with disabilities or chronic conditions. It's only for physical disabilities. LTC supports cognitive, emotional, and social needs, especially for dementia and Alzheimer's. Cognitive health must be central to care models and insurance design. Medicare will cover it. Traditional Medicare does not cover custodial LTC like bathing, dressing. Families are often faced families often face surprise out-of-pocket costs or rely on Medicaid. My family will take care of me. Informal caregiving is emotionally and financially taxing. Many caregivers provide 40 plus hours per week without support. Caregiver burnout and financial strain are common. I'll never need long-term care. 70% of people over 65 will need some form of LTC. Denial delays planning and limits options when care is urgently needed. It's all about nursing homes. 85% of LTC recipients live at home or with family. Home-based and community care should be prioritized in infrastructure and policy. Aging in place is always best. Not always. Some homes aren't safe or adaptable for advanced care needs. Aging in place requires proactive home modifications and support systems. Toolkit opportunities. Want to co-create myth-busting guide for caregivers, policymakers, or community health workers? We could layer in cross-cultural beliefs about aging and care infrastructure gaps in rural or underserved areas. Decision aids or for cognitive health trajectories. Or we could design a participatory workshop that helps communities challenge these myths and builds adaptive care plans. What format would resonate most with you, with your audience? Community resources are often unsung heroes of long-term care, especially when you're designing culturally responsive, accessible, and participatory frameworks. Here's a curated list of examples across different domains. Local municipal resources. Senior centers offer drop-in activities, wellness checks, and referrals to services like home therapy, housekeeping, and transportation. City Hall and municipal offices connect residents to programs like Meals on Wheels, medical equipment loans, and safety checks. Park districts host health fairs, Medicare workshops, and immunization clinics, often in partnership with senior centers. Libraries provide lectures on caregiving, dementia, and legal planning, often led by local professionals. Cognitive and caregiver support. Family Caregiver Alliance offers guides, decision aids, and planning tools for families managing dementia or chronic illness at home. Adult day centers delivered structured daytime care, socialization, and respite for caregivers. Participant directed services allow individuals to choose their caregivers. Give me 2 seconds. Including family, friends, and customized service plans. Home and community-based services. Home care agencies provide skilled nursing, therapy, and personal care on a flexible schedule. Transportation services help seniors access medical appointments, groceries, and community events. PACE programs of all-inclusive care for elderly, integrate medical, social, long-term care for eligible seniors, especially underserved areas. Okay, guys, so that is B for you. Be back on shortly with C. For now, Gator Wellness. Take care, folks.